Today I'm going to talk a little about prenatal diagnosis of Down syndrome. Let's see how we can easily remember this. When you look at the changes in biochemistry that happens during a pregnancy with Down syndrome fetus, these are the main changes that we notice. There is reduction in the alpha fetoprotein levels, and there is reduction in the unconjugated estriol levels in the maternal blood, and also there is increase in the beta HCG levels, and also there is increase in the inhibin A levels. So in doing the prenatal testing, we make use of the changes in the biochemistry as well as the ultrasound markers to diagnose prenatally about a baby with Down syndrome. So when we look at the possible tests, I can categorize it like this. There are biochemical tests, and also there are ultrasound and biochemical combined tests. So I have mentioned here the first one is the double test, where we use double test in the sense you use two biochemical markers, that is beta HCG level and the alpha fetoprotein level, together with the maternal age to predict the likelihood of having a Down syndrome baby, and it has about 60 to 65 detection rate. And if we go for a triple test, so in the triple test the difference is, in addition to the double test, we combine the unconjugated estriol levels also. So it has a better sensitivity on detecting fetus with Down syndrome, that is 65 to 70%. So the most sensitive test of the biochemical group is quadruple test, that is where you combine the triple test with another biochemical marker, that is inhibin A levels. There the sensitivity would be around 75%, 70 to 75%. I have not mentioned it in this. So the other method of diagnosing is by combining the biochemical markers with ultrasound features. So the commonest method that is practiced is the combined test, which has a 90% sensitivity and about 5% false positive rate. So there I have mentioned about the combined test. We usually perform an ultrasound scan of the fetus between 11 to 13 plus 6 weeks, where we measure the nuchal translucency of the fetus, and we consider about the maternal age as well. And also out of the biochemical markers we use PAPA levels and beta HCG. PAPA means pregnancy associated plasma protein A, and also beta HCG levels. So these combined together we can have a sensitivity of 90% and false positive rate of about 5%, which is far superior to the previously mentioned biochemical tests, the double test, triple test, quadruple test. So this is superior. There is also there are some additional ultrasound markers where we can combine together with the combined test to increase the sensitivity and also to reduce the false positive rate. They are, in addition to the factors that we consider in the combined test, we add the following ultrasound features. We look for the features of ductus venosus flow resistance, and the presence of tricuspid regurgitation, and absence of the nasal bone in the baby. So that is also, this scan is also performed in the late first trimester. So together it gives you a better sensitivity of diagnosing a fetus with Down syndrome, that is trisomy 21. You will get a sensitivity of about 95% and a false positive rate of about 3%. Now there are newer methods where we test the maternal blood for the cell-free fetal DNA of the baby. I will talk about them in a later presentation. Thank you.